A varicocele is an enlarged vein in the scrotum. So about 15% of the male population actually suffer from varicoceles, and 40% of infertile men have varicoceles. And around 50% of the total infertility cases are male related, which I don't think a lot of people know. Often we assume that if a couple can't conceive, then it's probably to do with the women. But actually, a varicocele is one of the most reported causes of male infertility. So just a bit of background on the testes. They are located outside the male body for a particular reason. And that is because the normal body temperature is actually hotter than the ideal temperature for sperm production. So the testes are suspended outside the body because they need to be kept at a certain temperature for successful sperm production to occur. And this just makes sure that there is, increased airflow to actually keep them cool. So the network of blood vessels in the testes supply the testes with oxygen, and this helps to regulate the temperature. But when there's a varicocele, they actually make heat regulation very difficult because they actually block the flow of the blood with the oxygen back to the testes. And this can result in infertility because the higher temperature actually kills off the viable sperm in the testes. So the condition is usually accompanied with a reduction in the size of the testes and also a swelling of the scrotum. And most men who have varicoceles will actually experience a constant throbbing pain in the testes. But a lot of men are also symptomless, and these are only actually diagnosed after a sperm analysis and a physical exam. So when there's seen to be a problem with the sperm, then a varicocele is looked for because there are actually no symptoms. So if you suspect that you or your partner may have varicoceles, really important to get it checked out by your doctor because the sooner the condition is discovered, the better your chances of addressing it are. According to statistics, varicoceles actually appear more often on the left side of the scrotum, which there is no known explanation for, and they're also more commonly found in tall and lean men. So there are various surgeries and other medical procedures for varicoceles, and the operation is quite generally simple and straightforward, which is why many doctors readily perform this surgery on infertile men with varicoceles. So unfortunately, only 30% of patients who actually undergo this surgery had experienced an improved sperm count. So in other words, the remaining 70% of men who have the surgery, there's actually no improvement. And your doctor won't be able to predict whether your sperm count will improve after the surgery or not. So like you, they just have to wait and see. And only 15% of the men who do undergo varicocele surgery actually successfully father a child. So there are also varicocele treatments without surgery. And these treatments include a healthy diet, balanced lifestyle, and also supplemental nutrition. The goal with this treatment is to improve the blood circulation, to strengthen the walls of the veins, and also to cleanse the reproductive system. So if we were to do natural varicocele treatment, we would recommend eating a balanced diet, lots of fresh fruit and vegetables. Start with eating whole grains and foods that also contain essential fatty acids, like some wild fish and nuts. You'd want to drink a minimum of 8 glasses of purified water per day. Always opt for organic foods over processed foods. And then also reduce the intake of junk food, trans fatty acids, caffeine, and alcoholic beverages. Recommendations would also be to minimize your intake of animal products and favor vegetarian sources of protein. A diet rich in vitamin C and bioflavonoids will strengthen the walls of the blood vessels, and they'll also prevent plaques from forming that can actually clog those blood vessels. So this plaque is a mixture of cholesterol and fats, and they adhere to the walls of the blood vessels and can predispose you to cardiovascular conditions as well. So complementing your diet with quality supplements, you'd want to take about 1,000 milligrams of bioflavonoids a day, also about 1,000 milligrams of vitamin C 3 times a day, about 30 milligrams of zinc, and 400 IU of vitamin E would be a good regime. There are also herbal remedies which can have been shown to improve varicoceles. And these are Damiana, saw palmetto, ginseng, and sarsaparilla. You want to make sure you're taking good quality supplements and herbs, so speak to your naturopath about accessing the supplements and making sure you're taking the right dosages of the herbs. So this might sound surprising, but it is also possible that yoga may be an effective adjunct to treating a varicocele naturally, because certain yoga poses actually increase testicular blood flow. So this can actually flush out the pooling blood from the varicocele and actually also cool the testes. And benefits of this are an alleviation of pain, an improvement of fertility, and healing of the varicose veins. And because yoga also improves posture, muscle tone, and circulation, there's great benefits of doing yoga. Anyway, so if you would like to try yoga for varicocele treatment, have a look on Google put into search yoga for varicocele, and you'll see different yoga poses that might actually improve your varicocele.